good afternoon, and welcome to our panel discussion, Connected Healthcare of the Future, What to Expect. Clearly a tremendously important topic. One of the themes of this conference has been the enormous impact that the technologies we're discussing can have on how we provide care to patients and the experience of those receiving healthcare. And really delighted to discuss these themes in today's panel discussion. I'm James Garner. I'm the Chief Executive of Casia Therapeutics, and I'm joined today by eminent practitioners in this field. Dr. Gregorius Bimantoro, Chairman of the Association of Health Tech Indonesia, Dr. Ong Mint Oo, Deputy Chief Medical Informatics Officer at Tan Tock Seng Hospital in Singapore, and Benedict Tan, Group Chief Digital Strategy Officer and Chief Data Officer at SingHealth. Colleagues, welcome. It's great to have you here. I'd like to begin perhaps with a question that strikes me as an interesting one. We have really two very, very diverse countries represented here today. Singapore, on the one hand, a smaller population, very urbanized, a tight geographic area, quite an integrated health system. And on the other hand, Indonesia, a vast population spread over the enormous geographic diversity of the Indonesian archipelago. Very interesting comparison here about how connected healthcare can manifest in these two very, very different environments. So I'd like to ask, first of all, for your thoughts about how the opportunities and challenges of connected healthcare and virtual healthcare manifest in these two different countries. Benedict, perhaps I could turn to you first of all.
Right. Hey, thank you so much, James, and happy to be here. That's a very, very interesting question, James, that you just posed. I think in this case, like the old adage goes, size sometimes does matter. So in this case, it's not working the other way around, but it's actually the reverse. Singapore being small, right? In terms of connectivity, we have a slight advantage, right, over a country of a bigger geographic mass. So in Singapore, also the government has been pushing a lot of smart initiatives. So in terms of the infrastructure, things have pretty much been in place, right? So we have all the homes, offices, everywhere around, MRT stations, we are kind of pretty wired up and connected. So that's very, very important to start with. That's the basic infrastructure we need to have in place. Of course, then the next thing to do is about putting in the necessary software. And in this respect, Singapore is also quite advanced. So we actually have in place or have implemented, the Ministry of Health actually implemented the what we call the National Electronic Health Record. It's actually a spine that kind of have all the patients, all the residents' medical information uploaded and accessible by people who have signed up and connected to the NEHR. So in that case, it's kind of like one resident, one medical record, right? And that has been in place about more than about 5 to 8 years ago, and it has been serving us well ever since.
Excellent, thank you. And electronic medical records seem to be just one of the key enabling technologies here. So it's really interesting to hear how Singapore is approaching this. Ong, if I could turn to you, I know you've had some interest here in a very different tack, looking at how some of these technologies can be applied to things like medical education. I would just be very interested to hear your experience and perspective here.
Sure, thanks, James. It's quite honored to be here again. Yeah, so you know that we are connected in terms of using the medical health record, right? See, these are the resources which can be used. Of course, we need to de-identify it, right? For example, for the scans there's a real life, the patient scenarios, right? If you can make it available without the identifier, so perhaps it can be a very huge resources for the medical education as well. For example, let me talk as a surgeon perspective, right? So we have interesting patient scenarios together with the so-called scans, right? Real scan, right? So entire journeys, we know that. So using this in terms of the medical education, including in the future with the very safe platform, of course, with the privacy and then the confidentiality is observed. We can probably even use the so-called the specific scan and then a specific surgery performed to the patient, right? And then use the entire patient journey as a teaching material as well. So these are the something is how can we use the so-called the information available from us as real life scenarios to help for the future education as well. Thank you.
Thank you. And it's certainly a theme that emerges there in both of your answers about the potential integration of information and healthcare provision here. Bimo, how do things look from Indonesia? I imagine very, very different challenges and opportunities there.
Yeah, thank you for your time, for the time being here. I think in Indonesia, we see there is a gap between like big cities and the rural areas, right? Because our population spread like 60% in Java Islands, right? And then more in like Jakarta, greater area, West Java, where like connectivity is much better. I don't say it's better than other countries, but it's much better than the rest of Indonesia. So being connected is something it's daily life, right? And in the healthcare also. And I think we also see how becoming the telehealth as an integrated solution is showing up right now. From the preventive to the monitoring. But if you are speaking to the remote islands, it's still very hard to get connection. So we don't rely on the like 3G, 4G. Like basically, if you got the cellular connection, you're already lucky, right? So this is the problems that we are seeing, and also the opportunity, because we can do a lot of things to try to get healthcare service on this remote area too.
Very interesting. And I'd like to move maybe just to build on the points you've all made there to talking about a very specific set of opportunities and challenges. And of course, no conference these days is complete without discussion of the C word, COVID. Life has changed after the pandemic for all of us. And that seems to have created some additional opportunities and challenges around connected healthcare, both in terms of reducing exposure to infection, reducing the burden on our physical healthcare infrastructure. I'd be interested to hear how the pandemic has both accelerated and perhaps impeded some of these things in your experience. Again, maybe Benedict, perhaps I can turn to you first.
Right, sure, James. You know, the articles that are floating around and say that, you know, there's a questionnaire that was posed, who is the most successful or most effective chief transformation officer? And I'm going to answer tongue-in-cheek is COVID-19. Certainly that's the case. So all of a sudden, you know, because of you know, the need to keep safe distance, and then to isolate and so on and so forth, we have no choice but to turn to technology. Yeah. So overnight, we see a huge uptake of people going on telemedicine, telehealth, video, going through video consultation, home delivery of medication, and so on and so forth, right? So in the past, the uptake admittedly has been a bit sluggish, right? But you know, when COVID strikes, you know, everybody is very comfortable with such a technology. And I say in part it's because it's not just for healthcare, it's actually for the whole society, right? Schools are on Zoom calls, you know, could be conducted through Zooms, etc., etc. And that in a way actually helps because, you know, the aged and the less people that are less familiar with technology, you know, they have kids, they have children, they have grandchildren who can actually help them to adopt and adapt to the technology much faster, right? And basically, it's Hobson's choice. A lot of people don't have a choice but to actually learn technology and to use it. So that now the challenge is how to, when the situation gets better, how can we carry on with such a change? Because we can see that it has dramatically improved productivity. There's not a lot of significant changes to the quality of care. And, you know, you save time traveling up and down, waiting in the doctor's waiting area, you know, risking more infection and so on and so forth. So how can we kind of make that change stick? That's going to be the ongoing challenge. Thanks.
Yeah. No, it's a great point, and as you say, it really illustrates the point. I think that here we are at a conference that's been conducted virtually via Zoom, and really just goes to show, as you say, how broadly some of these changes have permeated through society. I'm going to be interested to hear your perspective here. I mean, you're of course a practicing surgeon as well as as well as a leader in this field, and surgery isn't quite so easy to virtualize. How do things look from where you sit?
Yeah, thanks, James. Yeah, it like Benedict mentioned, right? It is COVID has changed us a lot. So it's a very successful chief transformation officer, right? So I like the title given to COVID as a positively. Yeah, so right, with the connectivity here, and then the last time, right, we need to travel. For example, I want to do the so-called training in the rural areas, or the less privileged countries. I need to fly down all the way, and then perform the live surgeries or training, and then a workshop and come back, right? So now with the very good connectivities, and then with the more and more advanced in the secure platforms, right? We can do more by the so-called telementoring in the surgery in the future. For example, I can transmit the so-called live surgery over to the countries, and then they can perform, the local expertise can perform the surgery, and we can comment on that, right? So it was already, this concept has been not new. It has been you may know that it's a telesurgery has been there for many years, but I think that it was not popularized because of some concern on the connectivity issues. But now with the technology, it is more and more advanced, right? And then we can, even with the 5G and 6G in the future, right? I think the connectivity or latency may not be a big issue in the future. Yeah, so these are the few things we can look into it. Now, last time when I want to go for education-wise, right, I cannot attend many conferences I wish to, because I need to go down, the physically. So now with the Zoom webinars, also the pre-recorded videos, or also available online, I can join anytime, and then these are very helpful information for the healthcare professionals like us, right? So we don't necessarily to fix the time to attend one conference. Sometimes it's one conference, the other conference at the same time, or not happening at the same time in a different part of the world. I only can choose one conference, right? So now I could easily information is easily available for us, and I can choose what I would like to attend to the particular topics, right? Similar to this current conference, right? It will be available for 1 month, if I remember correctly. In that case, right, whoever couldn't join can repeatedly join and then listen to our recording accordingly. Yeah, thank you.
Yeah, no, excellent. That's and Bimo, you spoke about some of the connectivity challenges in Indonesia, and not everybody has, Ong is already looking ahead to 6G, and I realize, not everybody has even 4G yet. How has COVID changed the landscape for you in Indonesia?
Yeah, I think I will be pointed out 3 things here. So the first one is the Ministry of Health really catch this to move forward the digital transformation in healthcare that I think has been stuck around like 15 years due to like a bureaucracy in healthcare and the system, etc. But they are really moving forward. And last year they just create a new digital transformation office in MOH, and this has been moved forward a lot of things. I mean, the peoples might be still the same guy who work in the health informatics, etc. But now we are doing it together with support from all parts of the infrastructure, etc. So and I think Indonesia also for infrastructure is going with a lot of partners. Also, I think with SpaceX too, and there's a lot of infrastructure solutions that are going to be launched this year and next year. And second one is from the provider side, right? So like hospitals, they need to do a lot of things to be available, like doing the telemedicine is one thing, but the other is like how to keep all the patients connected while the behavior is like users are usually mostly in the social media, right? Not doing others in doing others in internet, only like on social media. And then the third one is from the consumers health. So I think already available are like blood glucose tests or others device that can be connected, right? But the educations to use this is something that was never like trending before, because like, yeah, people just take a blood glucose, and doing a telemonitoring is also some parts of the big parts of the healthcare, right? Because the chronic condition patient in Indonesia is a chronic patients is also very huge numbers, like diabetes in Indonesia, I think number 4 or 5, right? But so this is something that we can move forward with the transformations in digital health.
Bimo, thank you. And I think you make a very interesting point here, that when we talk about connected healthcare, we often think first of all about telehealth or telesurgery, teleeducation. We think of this first of all as a communication tool as much as anything else. It's a way of saving the need for a physical meeting. We can do things over a computer screen. But I think you touched on a really important point there. And of course, this conference is about the Internet of Things. It's about physical technologies and hardware as much as how we use it. And you mentioned wearable glucose monitors there, Bimo. And I wonder if you could expand on that and just talk about the role of wearables and remote monitoring and sensorization, particularly in an environment such as Indonesia, where not everybody lives a short distance from a hospital.
Yeah, it will be a great advantage for the consumers, right? Because yeah, I think not everyone in diabetic patients are going to take an A1C test like every year even, right? Because it's not easy to reach the lab in remote areas. But I think at least the blood glucose, consumer test blood glucose is available. And then we also see from the last 2 years, the huge leap with the wearables, I think in the form of like even smartwatch, like right now detecting blood glucose, and they're improving the algorithm even for the blood pressure, etc. I mean, I believe the AI side in this IoT is still progressing very much. But this is huge. Yeah, right now it's available. I think the price is still a challenge here, because like connected wearables or health device is I think still like 50% or even 100% pricier, right? It's still expensive. But if we can do this in massive or in Indonesia, like we count all the diabetic patient here, we can take down the price. So it's an offer for you guys, all the IoT developers, that we can do for Indonesia and the rest of the world, of course.
I thank you. I think that's really interesting. And to stay on the theme of hardware there, from the small and almost the consumer-focused devices, such as sort of wearable monitors and so on, right up to the other end, where we've really interested in some of the progress that's been made around, for example, robotization of surgery and things like that. I'm wondering if you could comment here. It's in one sense both one of the most exciting applications of this kind of technology, and in some respects perhaps one of the most terrifying. And really interested to hear how you see some of the applications of these kind of very, very new hardwares and technologies to the practice of surgery.
Sure. Thanks, James, for the interesting questions. Yeah. So we know that currently we're using the so-called robot-assisted surgery. Yeah. So with the robots, the movement of the robots, even though it's currently controlled by the surgeons at the console, but these are the enormous amount of data we can analyze. For example, how does this movement, right? And then there is the so-called visualization of the surgeons by the so-called video or 3D images, right? So there are a lot of things we can, why the surgeon move that kind of movement to troubleshoot, let's say for example, bleeding, right? So there are a lot of obstacles in the surgical field, and how did they try to achieve that? So there are a lot of movement in terms of the degree of the movement, the amount of the force they use, right? So with the currently, even though it's a minimally invasive surgery, we don't have a sensors, right? But in the robots, we have a sensor. So there's so many sensor inputs, which can be enormously huge data for us to analyze. And then in the future, possible AI driven or some semi-automatic or or fully automatic kind of the so-called robots. I mean, that was possible in the science fiction, the movies, right? But it is possible with the current technology. It is a matter of time. The only thing is that whether should we adopt it or should we have some, even though we want to innovate, but not to be so-called disruptively innovate to take away the so-called autonomy of the operating surgeons. So these are the very fine line we need to think through when we innovate. So these are something I would like to comment on that. Thank you.
Oh, that's fascinating. Thank you. And as you say, some of these discussions very quickly sound like the stuff of science fiction, but you make a great point. These technologies are here today, and both Bimo and Ong, you've brought up, you've mentioned AI as one of the kind of underlying technologies here, and I know Sing Health has had some interesting forays here into this space, and I'd be really interested to hear your perspective on how AI and machine learning, as much as the hardware of wearables and robots and so on, how the application of AI can transform healthcare.
So James, just speaking a bit on our experiences, we have what we call the Selena Plus. It's actually a solution that helps to read eye images and detect retinopathy, right? So the benefits is tremendous, right? So what happened was before Selena Plus was introduced, right? A patient will have to go to a clinic, have his image taken, and then wait for a day or two for someone to read the image, and then get back, and then have the diagnosis, and then plan what's the next course of action, and so on and so forth. Yeah, with Selena Plus, that time has been shortened to an hour or less, right? So the image is taken, sent, uploaded, the AI reads it, right, and the results are back almost an hour. So the patient, that in terms of anxiety, in terms of time saved, the number of visits to the clinics are all being reduced, and of course, not to mention the overall efficiency and productivity of the reader and the doctors themselves. So AI is going to change the world of healthcare, and personally, I feel that where it would move the needle very, very significantly is when we apply AI to the masses, to the general population, to teach them how to take care of their health, right? So for people who are diabetic, right, teach them how to manage the diet, to exercise, to even titrate and kind of change their concentration in terms of their insulin intake and so on and so forth. And this is just one example, right? The possibility is tremendous, is huge. So I'm actually looking forward to working with industry. I mean, look, coming together with Bimo, with Ong and everybody, and see how we can explore and tap on AI for the good of mankind. Thanks.
Thank you. Exciting stuff indeed, and really interesting to hear. And I want to shift gears slightly here and pick up on something that's just emerged in your comments here. Shifting it a little bit from the technology and the equipment, the hardware, to the pathology, to the practice of medicine here. Each of you have touched on diabetes and metabolic syndrome and obesity, this whole cluster of illnesses, as being a really interesting use case for connected healthcare. And I'd like to maybe explore that further. But as you just spoke, you made some really interesting comments there, I think, about the potential role of AI in terms of understanding these things. Ong, I'd be interested to hear perhaps your comments on just how Singapore has been thinking about this massive public health challenge in terms of connected healthcare and these kinds of technologies.
Yeah, thanks, James. Yeah, so currently for those in Singapore might know that we have a health promotion board, the STEP challenge, right? So they are the health promotion board in terms of the public health for the awareness of the health to take care of our own health. So they given issuing the so-called step trackers, right? Which step trackers is the wearables, which also have some currently is a season 6, which is the so-called sleep challenge as well. So that you wear the wearables and then the clock whether you have been enough sleep. So these are the few things is the public health we can consider. So being the surgeons which is interested in the obesity and then the metabolic syndrome as well. So for me, it is very interesting because these are the very interesting variables data, right? How much is the steps you and how is it well sleep or not? It impact on the metabolic syndromes. And then second is the activity, right? So currently we are using mobile phone. Everybody has a mobile phone, right? And then we use a credit card to pay, right? So then in that case, you wish to which restaurant, right? How much is the right? But even though menu is not in sight, but some things these are the data to track, and then they inform the and then with the AI, right? So okay, today you are less sleep, you have a less working activities, or you eat too much, or something like that, and then the algorithm to remind the users about their healthy habit or non-healthy habits. And then if you can integrate for those in the so-called EMR system, I think Benedict talked about the EMR earlier. So these are so that we call it the personal health data, which will be integrated into their electronic medical record systems. And then the meaningful analysis on this, and then the feedback to the patients, the portal, and tell them that, oh, please, your diabetes is so high, you should look after this, that these are the food you should avoid in the future. And then we continue monitor with the or trending kind of thing, so that at least each individual patients can look after on their own with the visibilities, with the help of the technologies. Yeah, thank you.
Fascinating. And it sounds very much like a sort of government-led initiative here through the Health Promotion Board. Bimo, I got the sense from some of your earlier comments that in Indonesia, this was perhaps a little bit more consumer-led. It was sort of coming almost from the opposite direction. I'd be interested to hear how how this has played out in Indonesia in terms of the use of some of these technologies around diabetes, and particularly about perhaps different actors driving the process in that environment.
Yeah, I think Indonesia is very broad, right? So we have also the A+ community that they can bring in a device that is not available yet here, but because it's not, they are not restricted to buy it in other places. Like you can buy it in Singapore, Australia, anywhere else in the world, and then they bring in here. So the doctors, a lot of times, the specialists usually need to learn this because their A+ patients then bring this and asking a lot of questions about like continuous blood glucose monitoring, and also like continuous. We see some IoT devices connected that between the test and the insulin pump, right? But yeah, I think it's still in trial in some countries, and but they also do here right now in Indonesia because there is a lot of diabetic populations here. So it's very interesting that at some points we also see that the doctor specialists need to learn very fast what is happening or trending outside, because the patients a lot of time bring it in here, even though it's not have the it not been available like formally here, right, in Indonesia.
Yes, understood. Just very interesting how the very different roles of government and society in terms of driving these things. In many ways, it's a great democratizer. We've spoken a lot about some of the potential here, some of these really interesting applications in diabetes, in telesurgery, and medical education, in all sorts of different areas. I want to just perhaps sort of ask a question here, perhaps a little bit more of a kind of note of caution around our readiness for some of these things, because obviously underpinning all these things, we need to have the plumbing and the enabling technologies that allow these things to happen. Now, obviously, one key thing is internet access, which is increasingly ubiquitous, but we also often need things like common data standards and transfer protocols, storage conventions, all those sorts of things to really make these systems work together and deliver maximum value. And so I wanted to ask a question here about our readiness in terms of the enabling technologies, the plumbing, if you like, underneath all this. Benedict, perhaps you could comment there.
Right. From a data perspective, fully agree with you, right, that we need some sort of standardization, right? Otherwise, you know, when if you want really look into the subject of connected health, then at the atomic level is about data sharing, right? So if we do not standardize on data, then there's going to be a challenge in that kind of sharing or connectivity across the various equipment, across the various systems, across ecosystems, across countries, right? Maybe just an analogy or a reference, you look at COVID-19, right? The countries are struggling whether, you know, how to validate whether a person is vaccinated before he travels and so on and so on. So those things are still being discussed at the very moment. So data standardization is one thing. The other thing that I want to call out is the fact that, of course, you have, you know, the HL7, and now we're progressing towards the FHIR standard of interfacing and communication. The standards are progressing, they're going to be put in place. But the other thing that is that we all want to be cognizant of is the fact that right now, in terms of connectivity, right, a lot rests on the individual institution, even department, and at Singapore, it's actually at the country level. So when we wanted to do our National Electronic Health Record System, so James, you rightly pointed out, one of the biggest challenges is actually on data standardization, right? Even lab tests, for example, right? For calibration measurement, you have two different standards. So when you want to put them together in a common repository, right, you have two different standards. How are you going to chart it for a layman, for a patient? Because two different standards, you know, if you just take it verbatim, everything is going to go all right, right? It doesn't make sense. But if you want to convert it, how can you convert it? It's not that easy, right? So I mean, I want to echo on in that the technology is there. Question is, how can we all come together to work together towards standardization, towards interconnectivity, and so that, you know, everybody can look forward to a seamless kind of information. Especially, again, I'm talking about for the layman on the street, right? The man on the street, not a doctor, but a person on the street. Then you can then apply AI, apply machine learning to all these data, and make health and healthcare available to the masses, and that would kind of bring the costs of healthcare down much more. Thanks.
Well, that's great. It's so often the way with any new area, we always end up building the aircraft as we're flying it, and I think this domain is no different in that sense. But I'd like to just maybe raise another question that's sometimes no doubt asked of all of us as practitioners, and that's the question of equity, of access. I think, Bimo, you touched on a really interesting point here in the Indonesian context, which is that not everybody has great internet access, and equally, not everybody is tech savvy. Not everybody really knows how to operate a computer. So, and so in one sense, I think when we talk about connected healthcare, it feels like a great equalizer, a great democratizer, but also perhaps creates new divisions. And I'd be interested to hear your thoughts there, particularly in the Indonesian context.
Yeah, I think so, because the Health Tech ID as an ecosystem partner for the digital transformation office in MOH right now. So basically there is a platform as a service, as they call it, Indonesia Health Service, which being on top of it, they are building two big systems right now. The one is interoperability with the healthcare, agree with the FHIR standard, so it's more into the provider side, and the other is like what they call a citizen health. So it is right now built on top of the Peduli Lindung apps. It's the biggest health app on earth, I think. 50 million users and 7 million daily active users. But like I said before, a lot of people have not been using even smartphone like in fully functional, right? So they also developed like a WhatsApp chatbot. It's very effective, especially in Indonesia, for the certificate, vaccine certificate, COVID-19 vaccine certificate, and then also for a lot of question like telemedicine for the self-isolations. So I think the need to work on the right technology, the access technology to this, like not only having biggest users on apps, but also like, yeah, people still using WhatsApp, so why not using also the chatbot for WhatsApp? So the point is like how to give access to this technology for the connected healthcare, right? So that's, I think, what we are doing right now. And also the last one is like we are building a regulatory sandbox. Indonesia finally are going to have the health tech regulatory sandbox, learning a lot from Singapore, from Australia, for around the world. And we are doing trial for the e-malaria, but I believe our second semester we are going to have full scale of health tech regulatory sandbox also to move forward all the innovations.
Thank you. And clearly some challenges there, but a lot of activity, it sounds, in Indonesia in particular, to make sure that nobody gets left behind as we move into this very different world. And that's really encouraging to hear. And colleagues, I think this brings us almost to the end of our session here. We just have a couple more minutes here, and I think perhaps as Bimo's comments really just start to look ahead to the future and how we manage through some of these important transitions, I'd like to perhaps conclude our panel discussion here by asking each of you to cast your mind ahead, to look perhaps 10 years into the future, and imagine that we're all sitting down here in 2032. And we're looking back over some of the important things that have happened in the last decade, some of the very significant changes that connected healthcare has made to our practice. And I'd really like to hear your vision of the future. And colleagues, I'd encourage you for your wildest speculation here. We won't hold you to this, but really want to hear just where this could take us as a society. So Benedict, if I could maybe start with you.
Right. With the technology progressing at such a high speed, right? By 2032, I personally, I would hope that everybody would be a doctor or a nurse, right? To be equipped, to be aware of how to take care of their health. So right now in Singapore, the emphasis is on health, not healthcare. Once you cross the line to healthcare, sometimes there's no turning back, right? So once you become diabetic, you cannot become non-diabetic. So hence, we want to focus on the part about keeping people healthy, right? And that's where, again, how we can bring down the rising cost of healthcare in many countries, right? So 2030, with AI, with the IOMTs, devices getting smaller, much more accurate, medical grade, and so on and so forth. I'm hoping that one do not even have to leave the house to see a doctor. In fact, may not even want to see the doctor. But the big question here is, because healthcare is a high-touch industry, right? Many times it's not the equipment that gives you the comfort, the assurance. It's actually, you guys, doctors, practitioners, right? The comforting voice of the doctor, assuring voice of the doctor, the soft and warm touch of a nurse holding the patient's hand. So I'm hoping that we can blend high touch with high tech for our patients and for our residents going forward. Thank you.
No, thank you. And Bimo, very briefly, how do you see this going? Where will we be 10 years from now?
I couldn't agree more with Benedict. Actually, high touch, high care. But to edit this is like being like with the predictive and preventive health will be the biggest part of the healthy lifestyle, right? So healthcare is moving earlier to becoming more healthy. I agree with that, with the predictive and preventive. And then when they need to go to healthcare, I think one of the big leap in Indonesia was like paying with QR, right? QR was around since 80s, I think, but Indonesia suddenly the people are doing this like just scan, and I think Indonesia also moving forward with the national ID using QR. And what is more important, when they need to access the healthcare, they can just like scan QR and then get all the previous data through the interoperability, and then being there, boom, in the in front of the doctors that now serving the patients right now. So I think that it's very important being healthy. And then when they're going to healthcare, it's really easy to access, not to mention also all the scrutiny in the legal form, like inform, signing everything, doing a lot of writing. So it's gone. Right? They can just scan QR and then everything is there.
Sounds a lot more straightforward. And last words on this topic, Ong, how do you see us going over the next 10 years?
Yeah, thanks, Benedict. Thanks, James. Yeah, I think I echo Benedict on the few things. One is we should not forget about the doctor's patient or healthcare professional and patient relationship, which is based on the human touch, right? Even though we move on to the tele or in the connectivities, right? Some things need to be preserved. For example, how to engage the patient, right? Even though now we are looking at all electronic medical records, are looking at the patient, and not even looking at patients or listening to the patients, right? These are some things we need to be aware. So healthcare professionals should be trained that way, even though we have information rich resources in the electronic medical record systems or electronic health record systems, but the human touch, even though we move to the telehealth or tele-mentoring or tele-surgery, how can we ensure that this human touch is observed and preserved for the time being? The second thing I think is that for the future, with the so much advance in the technology and all these things, perhaps the moving from the healthcare to health, right? What Benedict has mentioned correctly. So more preventive measures. But what I worry is that we might see some new diseases, right, including the mental health, because of the information overload, over anxieties, anxious, worrisome, because we know that like a tracker, right? Oh, my sleep is deprived, right? I'm not active enough. I might have a heart attack in the future. I might have the cardiac. So these might have some anxiety-related disorders or some mental health issues in the future. So we need to be very careful when we drive the technology. We make sure that the transition is smooth. Yeah. Thank you.
Yes, no, I think that's a tremendously important point. I think with all this exciting technology, we all have to remember that at the heart of everything we do is the patient and their well-being and their needs. And I think that's a very appropriate point to conclude our panel discussion. It's been a really fascinating conversation, colleagues. Been a pleasure to talk this through with you. Many exciting things ahead, and I think going to be a really interesting time to see how the world changes under these very dramatic and important influences. Colleagues, thank you very much indeed, and we'll look forward to talking soon.